Kumar, and here is your question. Right, so if you have understood and read and understood considering this surgical pathology station, kindly tell me how would you explain the report to the patient?
Hello, ma'am. Hello.
Yes, if you have read
Yes.
and understood, can you tell me how would you explain the report of the patient to?
I will explain the patient that there is a carcinoma and hello.
Yes, continue please.
There
I'm
is
listening.
there is a carcinoma and
Yes.
there is a chance of recurrence and there is a chance of metastasis and it needs radiotherapy and other treatments.
Okay. What is the most common carcinoma of the colon?
Most common is the adenocarcinoma.
Okay. What is adenocarcinoma with melanosis coli? What do you understand by that?
Melanosis coli is a disorder of the pigmentation of the wall of the colon
Yes.
that is identified during at the time of the colonoscopy. It can be benign and adenocarcinoma means there is a benign epithelial neoplasm producing glandular patterns and to the neoplasm derived from the gland but not necessarily exhibiting glandular patterns.
How can carcinoma of colon be staged?
It can be staged according to the Duke staging. Stage A, which means it is involved submucosa. Stage B, it involves muscularis mucosa. Stage C, there is involvement of the lymph node. And in case of stage D, it involves distant metastasis.
Okay. Can you define the term adenoma?
Adenoma is applied to benign epithelial neoplasm producing gland pattern.
What is the condition which leads to melanosis coli?
Ma'am, pass.
Yes, you will say I'll come back to this question later. Okay, can you please tell me what is the management of colon carcinoma?
Okay, ma'am. Colon carcinoma can be managed according to the stage. If it is involvement according to TNM stage, if it is involvement of the tumor and the tumor size is T1 to T2, then we will go for excision. And if it is metastasis, then we will go for total colectomy along with the radiotherapy.
Okay, what are the risk factors which can be avoided for colon carcinoma?
The colon carcinoma, there is some non-modifiable like genetic factor, family history, or patient age more than 50 years, the patient who are taking low fiber diet, and the patient family history of colon cancer.
Considering a patient has a family history of colon carcinoma, how would you advise, according to NICE guidelines, to follow up the patient? How frequently would you follow up the patient?
I will ask the patient to screen at the age of the 12,
Okay.
and if
How
have
frequently?
colectomy, if it is diagnosed, then I will have to advise for colectomy at the age of 20.
All right, good. Okay. This colon carcinoma, according to TNM classification, how can you classify that?
What is T1 is involved only mucosa, and T1 through muscularis mucosa extending into the submucosa, and T2 through submucosa extending into the muscularis propria, and T3 through muscularis propria into serosa, and T4 which affect the organs.
Can you please tell me how would you define carcinoma?
Carcinoma, ma'am. It is a tumor of the epithelial. It is a tumor which is epithelial in origin.
Okay. Right. Are there any genes which are associated with carcinoma of colon?
KRAS, APC,
Yes.
P53.
Yes. Can you explain the sequence of these genes? How they stepwise accumulate and
Ma'am, I don't understand the question. Can you repeat?
yes, can you tell me the sequence, how these genes accumulate and cause mutations of oncogenes?
Okay. Like in case of
Like
APC,
yes, that causes hyperplasia.
there is hyperplasia.
Yes.
Yes.
Then
In
KRAS.
case of P50 KRAS, there is dysplasia,
Yes.
and in case of P53, there is
Adenocarcinoma.
and adenocarcinoma. Yes.
Can you
Adenocarcinoma.
please tell me the function of KRAS genes?
KRAS gene is a gene which is responsible to act on the which
It's a protein, right?
yes,
For-
it's a protein.
so how
Yes,
it acts?
it's a protein. It's a protein. It I totally forget about it.
GTPase.
Yes, GTPS. It acts through the
molecule.
GTPS.
So, yes, that you have
Yes.
to explain. Okay. Can you tell me about the function of APC gene then? Can you tell me the difference between, can you please tell me the difference between ulcerative colitis and Crohn's disease?
Ulcerative colitis and the Crohn disease. The Crohn disease usually confined. Crohn disease is confined only into the terminal ileum, but ulcerative colitis is confined to the rectum, and Crohn disease is mouth to anus, ulcerative colitis rectum and colon. In
Which
macroscopic
one is
feature,
most common to present or result in colon carcinoma?
adenocarcinoma is the most common.
No, but out of Crohn's disease and
Ulcerative colitis is most common, ma'am.
Good.
And in case of Crohn disease, there is cobblestone appearance and after ulceration. And in case of ulcerative colitis, there is pseudopolyp and extensive ulceration.
Yeah.
And usually Crohn disease present with the transmural and ulcerative colitis with the superficial. And in case of Crohn's, there is skip lesions, and ulcerative colitis, there is continuous.
Good. Okay. Yes. Started, and here is your question.